afternoon, Darryl.
Hi.
My name's Ali Kenna, the Associate Chief Nurse for the hospital.
Oh,
And I work a lot around falls and falls prevention in the hospital, and we're doing lots and lots of work around keeping our patients safe.
what is the beds are slightly too high, but the main thing when you get out of bed in the morning and you're warm, but you feel a little comfort.
Right, okay.
And that makes me react. So it takes 10 minutes for me feet to come to temperature. Bad water really controlled.
Okay,
Above that on my side.
okay. And was that from your chair or from the bed?
Bed.
From the bed. What do you think we could have done to help you to avoid that?
But then maybe add a carpet.
Yeah,
So I could prevent it that way, or I could put my shoes on in bed.
Yes.
Person in the wheelchair is without difficulty.
yeah. So would it be helpful to you if we looked at a different bed, or we could have looked at a lower bed for you?
Well, maybe, yeah.
Yeah.
In the walls upstairs, they've got new beds and lower.
Really, really useful to us, Darryl. Helps us to try and learn how we can avoid these falls, and I think by talking to patients we can get more ideas. Okay, that's been really useful.
Kimberly Salmon Jameson, Chief Nurse of Warrington and Halton Hospital. Ali, Amanda, I've just met with Darryl on the ward, and Darryl shared his story about how he'd unfortunately fallen twice. From that story, I wonder what you feel as Assistant Chief Nurse and Ward Manager on how we can improve care and prevent those falls in the
Certainly
future.
if I think about Darryl's case and what he's talked to us about today, what we're trying to do is we're trying to speak to as many patients as possible, because we think we've got the answers, but actually our patients are coming up with a lot more.
Yeah.
He's used to things on a different level. And also he talked about how when his feet touch the floor, he gets a shock, and that kind of give him a shock and contributes towards the fall. So from my point of view, big issues there around, we could have assessed him differently.
So I think we're thinking of getting a high-low bed, which will hopefully go a little bit lower for him, so there's a bit more of an equal movement over the bed, which should help to prevent them falls.
Footwear is another issue, and we're seeing that as a theme across the organisation.
Okay, so following the two harm-free falls that Darryl's had in the hospital, we did get together and we've obviously, with today's conversation as well,
Yes.
formulate a plan really on moving forward and how we're going to help to prevent falls in the future for Darryl as an individual. And he has already now started putting his shoes on in bed before he gets
Good.
out, which has helped.
Brilliant. Good.
So for me, there was two real issues there with what Darryl said, and what I would like to do, and the work we're trying to do, is help our staff to identify those issues before
Yes.
that happens. So we talk about falls every morning, a Trustwide Safety Brief. The Safety Brief gives us an opportunity to share the lessons learned from the falls that have happened over the previous 24 hours. The lead nurses and matrons provide the information daily. Weekly falls meetings brings together representatives from the Trust. We look at the previous week's falls that have happened in the hospital. We go through them in detail and share the learning across the organisation. After every weekly harm-free care meeting, the team conduct a falls walk in one or two of the areas that have had a fall the previous week. We look at the environment, we look at the documentation, we speak to the nurses, we just check the interventions for the patients are appropriate. We have also conducted a trust-wide chief nurse-led environmental walk around.
We do have a rail, but it is too far away from the toilet. And similarly, we have one rail at the side of the sink, but another rail that's too far away. So the gap to hold on to for any patient would be incredibly challenging in this toilet.
We also don't have any call don't fall signs up, which are across the rest of the trust, so we need to make sure we've got them in all our departments, all our toilets. So as a result of our involvement with the Falls Collaborative, we have focused on three main areas. We've introduced the multifactorial risk assessment documentation. We've had enhanced care policy written and approved, and we are starting training for that for formal rollout in November. And we have introduced visual alerts to demonstrate who is delivering enhanced care so it's easily identifiable at ward level and then eventually across the organisation.